Good afternoon, and thank you for joining us. This briefing is being aired live on YouTube. A reminder to maintain audio quality, to please keep your phones on mute until it's time to ask your question. If you're able to do so, please use *6 to mute and unmute your phone. Joining us for today's media briefing are Governor Tony Evers, DHS Secretary-designee Andrea Palm, and Missy Hughes, the Chief Executive Officer of the Wisconsin Economic Development Corporation. Also available to answer questions are Dr. Ryan Westergaard, a Chief Medical Officer with the DHS Bureau of Communicable Disease, and Ryan Nelsestone, the Chief Legal Counsel for the Governor's Office. We begin the briefing with remarks from Governor Tony Evers.
Good afternoon, everyone, and thanks for joining us today. Hope everybody had a safe weekend. As I've said before, I know this has been a difficult time for the people of our state. Workers, families, and businesses are struggling. We're missing time with our friends and our loved ones. But I have faith that we are making the right decisions now to ensure that better days are ahead in the near future. We are always looking for more ways to safely make progress in getting back to our Wisconsin way of life. The sacrifices that people are making by staying safer at home are paying off, and we continue to work through our Badger Bounce Back plan. Today, because of this good work, I'm happy to announce another turn of the dial on Safer at Home to add even more opportunities for Wisconsin businesses to get back to work in a safe and responsible way. Earlier today, Secretary-designee Andrea Palm signed an emergency order that allows all standalone or strip mall-based retail stores to offer in-person shopping for up to 5 customers at a time while maintaining required social distancing practices. Additionally, the emergency order signed today allows drive-in theaters to operate with some restrictions. This order is effective immediately. In addition to added flexibilities and steps we have already taken for businesses, this is another disciplined turn of the dial that will allow Wisconsin business owners to safely get back to work and Wisconsin consumers to support their favorite local spots. All businesses must continue to follow all safety precautions and guidelines as outlined in the Safer at Home order, and all businesses that are preparing to start bringing their customers back should consult the guidance that the Wisconsin Economic Development Corporation released just this last week. This guidance will help Wisconsin businesses prepare to re-engage safely so that employees and customers can feel confident when they return. Our businesses and workers have done a great job in adapting to our state's Safer at Home order, and that has been a huge part of our success in flattening the curve. Both customers and workers need to be confident in their safety, so we need everyone to be diligent in following best safety practices so that we can continue to move our state forward while keeping our neighbors, our families, and our communities safe and healthy. Today's order builds upon the Safer at Home order and the last turn of the dial through Emergency Order 34, which together allowed golf courses to operate, lawn and construction services provided by a single employee, curbside pickup for public libraries, and allowed every business to do deliveries, mailings, and curbside pickup and drop off. In addition to the good news that our main streets can really get going again, I am also happy to report that starting today, the Wisconsin Department of Health Services and the Wisconsin National Guard are supporting 2 new community-based testing sites in Milwaukee and in Madison. These sites are in addition to the community testing sites that have been operating in the northwest, northeast, and central parts of our state. We've continued to see folks coming to these sites to get tested, and that's great news. Increased testing and contact tracing are core elements of our Badger Bounce Back plan and are critical to slowing the spread of this virus and boxing in COVID-19. This is part of a series of efforts by the Department of Health Services and the Wisconsin National Guard to work with local health departments to create community testing sites in places with a known lack of access to testing or known community spread. These test sites are open to all residents and will provide free drive-through or walk-up testing. I urge anyone who needs a test to go get tested at one of these sites and help protect your community and family from this virus. No appointments or pre-registration is necessary to get a test. For more information or to find a community testing site near you, visit dhs.wisconsin.gov/COVID-19/testing. In order to keep turning the dial on Safer at Home and supercharge the Badger bounce back, we must have access to more testing, expand contact tracing, aggressively track the spread, and continue practicing safe physical distancing. We also suggest that folks wear protective masks in public spaces. If we stay diligent in these efforts, we will continue to progress through the Badger Bounce Back Plan, and we will safely get back to our Wisconsin way of life. And now Secretary-designee Andrea Palm will give her daily update.
Good afternoon, everyone, and thanks for joining us again today. We are almost a month into the Badger Bounce Back Plan, and we continue to make progress, as the governor has talked about. Our testing is up. We are currently interviewing hundreds of highly qualified applicants for contact tracing positions. The Battelle decontamination system is up and running, so please spread the word that healthcare workers should save their N95 respirators for decontamination and safe reuse. And 3 of our 6 gating metrics are green today. While we do the work of Badger Bounce Back, we know you are doing the work of practicing physical distancing, of limiting your essential trips, and of staying safer at home. The good news is that it's working. Thank you, Wisconsin, for your commitment to the health and safety of your friends, your family, and all of our neighbors. But as you know from our numbers, COVID-19 is still circulating in our communities, and additional Wisconsinites are getting infected every day. So we need you to remain vigilant and continue the work of Safer at Home and social distancing and the common sense, good hygiene practices that we've talked about together since the start of this pandemic. Another part you can play in moving Wisconsin forward is getting a test if you need one. If you're experiencing any symptoms of COVID-19 or if you've been exposed to COVID-19, you can get tested. Please call your healthcare provider to access a test. And we continue to partner with the National Guard and local health departments to offer community-wide testing where it is needed most. In fact, as the governor mentioned, new sites in Madison and Milwaukee start today. And to find out if there is a site in your area, go to our testing website, dhs.wisconsin.gov/testing. If you test positive for COVID-19, you will receive a call from a contact tracer. Please remember that contact tracing is integral to protecting the health of our state. And by answering the phone, you are helping keep your family, your friends, and your neighbors safe. So I want to give you an update on our numbers. Here's where things stand. Over the past number of weeks, we have redeployed about 400 employees from nearly every state agency in addition to the UW system to be trained as contact tracers. We've also received well over 3,000, about 3,350 applications for our contact tracing positions, and we have begun interviewing candidates. We've got 51 active labs running COVID-19 tests in Wisconsin, and our daily lab capacity is 13,795 tests. We have 108,033 negative tests, which is an increase of 2,870 over yesterday. And there are now 10,418 confirmed cases of COVID-19 here in Wisconsin, which is an increase of 199 Wisconsinites over yesterday. Our total deaths have reached 409. We are making progress, and like the governor said, that progress makes it possible to turn the dial a little more today. This is also why we need to double down on staying safer at home and practicing physical distancing, because we still need to make progress on those metrics that remain red for us. So thank you for all the work you are already doing and will continue to do to keep Wisconsin safe. And now I'd like to turn it over to Missy Hughes, who is the Secretary-designee of the Wisconsin Economic Development Corporation. Missy?
Hi, good afternoon, everyone. Now, today's turning of the dial by Governor Evers and Secretary Palm is really important for many, many businesses throughout Wisconsin. We have approximately 14,400 small retailers in the state with 20 or less employees. And so giving the opportunity for these businesses to re-enter into the marketplace brings back about 90,000 jobs as those come back online. So it's a really critical move in this concept of regaining momentum in our economy. And I want to touch on something that the governor pointed out late last week, WEDC in conjunction with DATCAP and the Department of Tourism and a lot of work from DHS were able to launch a set of guidelines for businesses to consider as they begin their process of reopening. So while not every business at this time is able to be open, under the Badger Bounce Back Plan, WEDC was tasked with the idea of helping getting our businesses ready. And so by standing up this set of guidelines, there's a general set and then there's specific industry sets, we're able to help businesses start to ask themselves, what are the right things we need to do in order to be able to have our business ready to receive our employees and our customers? So we have a broad range of different industries represented, but the one I want to touch on today is retail because of the governor and Secretary Palm's order. We have a specific set of retail guidelines, and they remind the retailers to be considering what's happening in the workspace, what's happening in their stores, and how to be able to act and respond to those things. So while we have the general guidelines always continuing of social distancing, hand washing, face masks, for retail in particular, we've pointed out some additional guidelines that the retailers should be considering. Things like face masks for the employees. Great signage really helps employees and customers know that we're living in a time where we need to be cautious of each other and thoughtful of each other. Just the other day, I was able to go into our local hardware store, and the signs at the shopping carts and as you entered reminded that taking these practices isn't only for your safety, it's for the safety of employees. And, folks who are coming to work right now, they might have someone at home who's compromised, someone at home who they're worried about. They're willing to come to work. We should show them the respect of being cautious around them also and taking into these practices that should become a part of our normal life. The other thing for retailers to consider are those high touch areas where there might be door handles or at the checkout stand, and making sure that there's a process in place and thoughtfulness in place around cleaning, all of those things. I'm not going to go through all of the guidelines today because you have the opportunity to go to wedc.org and to review those guidelines and have a chance to look at them. Those guidelines came from protocols that businesses all around the country and around the world have been learning and putting into place. So it's really important to realize that these guidelines are business friendly. They are meant to be something that is practical and useful for the businesses to take up. And, indeed, I've seen and had many conversations with businesses that want to be very cautious about this. They want to be leaders to make sure that no one gets sick on their watch. And so we should respect the steps that businesses are taking and work with them to be able to really foster that community spirit that we need to have in order to get through this together. I want to touch on one more item, which is right now, these guidelines are not mandatory. This is guidance that has been given. WEDC has worked with DHS to make sure that the guidelines are in conjunction with what DHS is recommending. And so I think it's really important to understand that it's upon all of us to take up these guidelines and to be working through them and to be ready when the businesses are able to open, or if you have the opportunity, like the governor has assigned today to retailers, to small retailers, you'll be able to open right away and should consider these guidelines as something to take up and use for the best of all of us. Thank you.
Thank you. We'll now open it up for questions. A reminder to maintain audio quality, to keep phones on mute until it's time to ask your question. And in the interest of time, only one question per reporter per media. From Wisconsin Radio Network. Bob?
Hi, I was just wondering some clarification on the contact tracer hirings. Is that position still being advertised, or is DHS still looking for additional people to fulfill those roles?
So the posting is still available on WisJobs, and as I mentioned on Friday, we very much would welcome additional applications from those who speak multiple languages. We have received certainly hundreds and hundreds of highly qualified applications, and would very much like to expand the number of folks in our pool that could serve Wisconsinites in more than one language.
Thank you, Bob. Now to Danny Maxwell from WKOW-TV in Madison. Danny? Danny Maxwell from WKOW.
Yep, can you hear me?
Yes, we can.
We noticed, and as you mentioned, that one of the gating criteria, the metric, was now green, the downward trajectory of positive tests as a percent of total tests within the 14-day period. Wondering how quickly health officials think that the next three criteria that you're looking at might happen once that one has taken place.
Do you want to take that one, Dr.
Well, I
Westergaard?
guess I'd say it's of course difficult to predict, but what the specific criteria that are green right now are the ones that are really reflective of our capacity and our response. So the hospital-based ones, meaning that our hospitals are reporting to us that they can provide care in sort of non-crisis mode. They have enough supplies, they have enough staffing, and they have enough resources to provide the highest level of care. Those have been green. The new one that just turned green or favorable today was the percent positive tests. So the number of tests that were positive as a percentage of all tests. And so that also likely reflects the fact that we have increased the capacity to do testing to a larger number. So we have to look at both sides again. It doesn't tell the whole story. 200 new cases every day, or 200 to 300, even 400 in the past week, is still too many. So that's bad news. But the fact that we've increased testing and the percent positive has not traveled with it means that we're not, that's the favorable news. That means that we're not uncovering a large number of cases as we scale up testing. So it really is a good development that as we've tested in more places, we're not finding proportionally more and more cases. But the absolute number of new cases is still higher than we want it to be. So as for the ones that are not yet, that are still in the red, those really have to do with what we're detecting in terms of syndromic surveillance. Syndrome meaning people who have symptoms suggestive of a respiratory infection like influenza or like COVID-19. We have systems to detect the number of people who are coming into healthcare settings and emergency departments with those kinds of symptoms. And as a indicator of how the overall epidemic is going, we want to see that those numbers of illnesses that are coming to healthcare settings are getting lower, and they've been flat or increasing recently. So those are the two that are really reflect the actual amount of disease in the community, and so those are the hardest to predict. We don't have as much control over those, other than to do everything we can to prevent infection from spreading, which involves testing, contact tracing, and the personal things for infection control like hand washing and social distancing.
Thank you, Danny. Now to Sarah Hauer from the Milwaukee Journal-Sentinel. Sarah?
Hey, so I'm wondering today just about the loosening of restrictions for retail outlets. It limits all across the board to 5 customers when you could have a very, very large store that's still limited, and that might not be economically viable to reopen. In your thinking, is this focused on more of those small retailers, or are you trying to open retail as a whole?
It's focused on small retailers. Clearly, I can't imagine, I don't speak for Kohl's Corporation, but I can't imagine them opening their stores with 4 or 5 people. All along, we're trying to mitigate the transmission of the disease, and one of the ways to do that is to start small. So there's, as Secretary-designee Hughes said, this is a huge number of not only businesses, about 14,000 in this state, but also 90,000 people that work there. So obviously we're looking at small stores like apparel, jewelry, electrical supplies, toys, clothing, home improvement, CBD oil, things like that, cell phones, vitamin stores. We have them all across the state of Wisconsin, and we're giving these folks a chance to be a partner with us to not only help open Wisconsin a little bit, but also to help us continue to fight the virus by keeping people safe with smaller numbers in the store, but still numbers, and keeping people safe by using the guidelines provided by the Wisconsin Economic Development Corporation.
Thank you, Sarah. Now to Michelle Melby from WLUK TV in Green Bay. Michelle? WLUK TV? Okay, then we'll move on to Scott Bauer from the Associated Press. Scott?
Does this allow barbers and hairdressers to continue to begin to see customers again? And how worried from a public health standpoint are you about these loosening of restrictions leading to a second wave of this, as we've seen in other places where restrictions have been lifted?
Yeah, first of all, the answer to your first question is no. A service isn't a good. Retailers, in our definition here, are retailers that are selling final products and not services. That said, we believe we've struck a sweet spot here. Small businesses, transactions are going to be with smaller numbers of people, and the reason we're doing this slowly is to watch it, and so we will watch it and see how it goes. We feel confident this is a good place to start, or continue to move forward and dialing it in.
Thank you, Scott. Now to Ben Meyer from WXPR Radio in Rhinelander. Ben?
Good afternoon. Governor Evers, I know you and your legal counsel had indicated several times that a lot of thought and consideration was put into tomorrow's 7th Congressional District special election, whether to do anything to alter that, and ultimately decided to go forward as is. My question is, how will you define success in tomorrow's election? Is it if no one going to the polls or no poll workers get infected when they're at the polls? Is it something else? Is it if the Democratic candidate is successful? How do you define success?
First of all, a success for me would be as many people as possible get out to vote. I know they've had a great number of mail-in ballots, and that's great for those people that feel uncomfortable. But a success for me would be to have everybody, not only poll workers being protected and doing the things they need to do to be protected, but also the people that are voting, 6 feet apart, all the things that are important. Wearing masks, if you feel comfortable doing that, I think that's an extraordinarily strong suggestion on my part. And, as going forward, as you saw with the election previously, it's difficult to say who caught what where. But at the end of the day, we want to make sure everybody's safe, and if everybody's social distancing and making sure that our poll workers are safe with the plexiglass and other items, that would be a success for me.
Thank you, Ben. Now to Eric Gunn from Wisconsin Examiner. Eric?
Thank you for taking my question. What is the enforcement process going to be? Will people be going around and looking to see if small retailers are letting in more than 5 people at a time, or are not urging people to stand 6 feet apart? What kind of measures will be taken to see whether these guidelines are in fact being respected?
Well, there's no secret place as part of our administration, so that's not going to happen. I believe the small retailers are really excited about having this opportunity. I've talked to a lot of them, and clearly we have added some structure to this, and that includes 5 people in the store at a time. But I feel very confident that the retailers in the state of Wisconsin, those 14,000 that do participate, will do everything in their power to do it right.
Thank you, Eric. Now to Victor from CBS 58 in Milwaukee. Victor?
Hi, good afternoon. Thank you again for taking this phone call. I guess my question is, what signs or indicators did you see regarding today's updated order? What signs and indicators did you see that made you feel comfortable moving forward with this turn of the dial? And what would you like to see in terms of maybe increasing the number of customers to 10, 15, 20, so on and so forth?
Yeah. Thanks for the question, Victor. What we used, and in particular I used, was progress on trend lines that were in the correct direction, and that is down. So I think we've done that over time, and it bounces up and down seemingly every day, but it's headed in the right direction. That's what we used to make this determination, and I would say going forward, as it relates to any other types of changes around dialing things down, would be a continued trend in that direction.
Thank you, Victor. Now to Jonathan Neiser from NBC 26 in Green Bay. Jonathan? NBC 26?
Yes. With more and more testing happening, I know there's some concern with individuals possibly seeking tests that it's a fairly invasive procedure, that it looks awful painful. Can someone speak a little bit to the current tests that are being used and what people can expect in the process if they go and get tested?
Yeah, sure. It's Ryan Westergaard. I'd be happy to discuss that. So the processes, or the number of procedures that can be used to do COVID-19 testing has changed and evolved over the past 2 months, and the current options are sort of the preferred is a nasopharyngeal swab, which is probably what you're referring to, that looks unpleasant. It's a swab that goes into the back part of the nose, and that's still considered the most sensitive and the preferred. But just in the past couple of weeks, we've had new data suggesting that other types of specimen collection are also acceptable. A simple nasal swab, so a Q-tip-like swab in the front part of the nose, is not as invasive and not as uncomfortable. And there's new data about saliva-based testing, which is not ready to be scaled up widely. But I think the science has really proceeded at a pace where the options will be continuing to grow. Potentially also including self-swabbing at home is something that the FDA provided some guidance about last week, that a number of companies are providing a system whereby individuals can collect their own specimen at home and send it in the mail. So right now, most people who are getting tested are getting nasal swabs or nasopharyngeal swabs, but I think the options are going to continue to increase in the future.
Thank you, Jonathan. Now to Sarah Seifert from the Eau Claire Leader-Telegram. Sarah?
Hi, thanks for having this call. My question is about tests for COVID-19 antibodies that are popping up around the state. What should people look for in terms of legitimacy of these antibody tests, and what kind of oversight is the state doing of the antibody tests?
That's a great question. I can discuss that as well. So the just in the past month to 6 weeks, a large number of products came to market in sort of an unusual way, where they were very poorly regulated initially, and a lot of companies could sell point of care or small antibody test kits without a lot of regulation. And the FDA recognized that a lot of those didn't have great data behind them, didn't perform as well, and those have been walked back a little bit. So Antibody testing now is becoming more standardized, is becoming more available in clinical labs and reference labs, so the performance is better, and they're being used in a wider range of settings. The important thing that we at the state and we healthcare providers want everyone to understand about the tests really is what they're useful for. And the test we were just describing, that we do a nasal swab or nasopharyngeal swab, detects the virus directly. Those are the tests we use to make a diagnosis, to tell someone whether they have COVID-19 or not. So if someone has symptoms, if someone was a contact and we're concerned that they have the virus, we have to use one of those virus detection tests. Antibody tests aren't useful in that setting. What antibody tests are useful for is providing evidence whether someone was infected in the past. So the biggest role for those right now is really as a public health tool for us to understand what percentage of the people in this community or in the whole state have been infected in the past. And we're looking into ways of using those tests strategically to answer those questions. The final thing that's very important to know for everyone is what they don't tell us. So the presence of antibodies doesn't necessarily mean someone is protected or immune from the virus. There's a lot of hope that will be the case someday. People have discussed the idea of detecting antibodies as a marker of immunity or protection, or using the phrase immunity passports. And it's very important for people to understand that the science doesn't support that right now. It's not to say that it never will, but detecting antibodies in the blood, we don't know enough from research to know whether a person that has those antibodies is protected from future infection. We just don't know. So the usefulness of antibody tests is still pretty limited right now, although they're becoming easier to get and they're becoming more reliable at telling whether someone has been exposed. And it's something that'll probably continue to evolve. So right now we see them mostly as a public health tool. And if an individual wanted to get an antibody test, it would be really mostly to satisfy curiosity, had they been infected. But it wouldn't really allow us to make any decisions about, is it safe to go back to work, or are they safe to be in contact with people who might be infected? We can't use it for those things yet.
Thank you, Sarah. Now to Mitchell Schmidt from Wisconsin State Journal. Mitchell?
Yeah, thank you everybody for the call today. So with the original public health emergency order expiring later today, I was wondering if you might be able to talk just a little bit about what sort of an impact, if any, that might have on the state's COVID-19 response, and if a new order might be considered. Thank you.
Ryan Elsestroen. So it has a variety of impacts on the state. So under the public health emergency, one of the main things that's available with a public health emergency is that local units of government can, when they're responding to the pandemic, they can seek reimbursement from the state. So with the legislature not having extended the public health emergency, that funding source is no longer available. So we're looking at alternative options on how to make sure that local governments can continue to combat COVID-19. Another thing that's impacted by it is the administration has issued around 30 emergency orders beyond the safer at home orders and turn the dial orders that do a variety of things in order to help state government, local government, the healthcare industry be able to respond better. And so it's been a wide range of things, from making providing licensing flexibilities for doctors so people can come in from retirement or from other states to be able to practice, to addressing issues with unemployment insurance and other things. And so unless the legislature stands up and extends the public health emergency, those things will go away tonight. In addition to that, the legislature, when the one time it actually did meet in session to address COVID-19, they tied a lot of those flexibilities and provisions to the public health emergency. And so without extending that public health emergency, a lot of those provisions will either expire today or will expire in the next 30 to 60 days after today.
Thank you, Mitchell. Now to Shelley Nelson from the Superior Telegram. Shelley?
Thank you for taking my call today. My question is, WMC has developed a plan to reopen business based on where it operates, the type of industry, healthcare resources available, and determining how to reopen business that way, targeting a more countywide or regional approach. I'm wondering, what are the dangers of doing it that way, and is that an option that the state is looking at?
Well, there's several things that I've talked several times about on this issue, and are there times when we might consider that? Possibly, but there are also concerns that as things are relaxed in some areas in the northern part of the state, for example, their ability to respond to a surge is limited. Their ability, and frankly, many of the folks that live there are of an age that they're more at risk than other parts of the state. But also, I'd say the most significant thing is, because I get feedback on both sides of this issue, is the concern that if something exists in one part of the state, there will be people coming from other parts of the state that may have a higher propensity of having COVID virus, and they would bring that right with them. And that is, I think that's something to be concerned about. That's why we chose to go statewide on the small retail businesses on a statewide basis, because we don't want people going from one state, one county to another just to buy baby clothes. They can do it in where they're living. And so it is something to consider. I don't think it's an answer, but it is something to consider. But at this point in time, we're trying to find statewide solutions.
Thank you, Shelley. Now to Casey Nelson from WTAQ Radio in Green Bay. Casey?
Hi, thanks again for taking the question. Mine kind of bounces off an earlier question. I know, Governor Evers, you said that salons will not be allowed to reopen and things like that, but what do these rules mean for places like salons or photo studios that they provide services, but they also provide retail, like they sell shampoos or things like that? What would the impact on that kind of service versus retail opening be with this new order in place?
The order in place, or that we just issued, is around retailing of goods, whether it's baby clothes, whether it's hunting and fishing supplies, whether it's clothing, whether it's toys, whether it's CBD oil, you name it, it's goods that are for sale. And we chose that for a very important reason. Obviously, when we talk about hair salons and other hands-on retail, that is a wholly different thing, and we're not prepared to do that yet because the risk is much higher.
Thank you, Casey. Now to Jason Calvi from Fox 6 in Milwaukee. Jason?
Good afternoon. I'm curious about the number 5. Why can a store like Walmart or Menards have dozens or more at a time in the store, but retail stores can only have 5? So what led you to that number 5?
Because the retail stores we're talking about are a smidgen of the size of Walmart or Menards. This is based upon small businesses, Main Street businesses, businesses that have not been open for several weeks. We think that they are deserving and have less risk than other stores, and that's why we chose them. This is about Main Street businesses, whether you're in an urban area or a rural area of the state of Wisconsin. And 5 people in a small space is a reasonable approach, and if there's more, all they have to do is set up the procedure to make it happen by waiting outside until somebody leaves. These are small stores.
Thank you, Jason. Now to Steve Westergaard from the Platteville Journal. Steve?
Thanks for taking my question. This is, I guess, kind of resulting from coronavirus changes, but it's not directly tied to health. Last week, the Department of Transportation said that they were suspending for the duration of the health emergency, having to go in to renew driver's licenses and then also driver's tests for first-time driver's license. Usually kids are 16. I'd like, if possible, for someone to explain the rationale for waiving the driving test, considering the accident rate of the youngest drivers across the country?
98% of driver's tests are initiated with DOT personnel. 98% of them are successful. In addition, the idea of bringing two people together, a young driver and or a new driver and somebody from the DOT in a small space is not particularly safe, and that's the main reason why. And also parents need to sign off on it.
Thank you, Steve. Now to Sean Kirkby from Wisconsin Health News. Sean?
Hi. I've spoken to a few healthcare experts that have talked about that the state could be facing some issues with finding PPE for providers and others for up to a year. Is that, how long do you think PPE shortages will continue? Thanks.
That's a good question, Sean. I wish we totally knew the answer to that. I think because it does continue to be such a priority for us, and it certainly does take a lot of time and effort of a number of members of the team at the SEOC to continue to be working on procurement, be working with our partners in manufacturing and long-term care and the hospitals to make sure we've got what we need. I think we're all hopeful that the manufacturing capacity that exists will be able to meet demand, will continue to flex and build up and be able to meet demand. But we continue at this moment certainly to be in a position where we need to continue to bang away at getting greater access to PPE, and we will do that until the pipeline for the goods that we need is able to meet demand.
Thank you, Sean. Now to Tajma Hall from NBC 15 in Madison. Tajma?
Thanks for taking my question. So today we are turning the dial, opening some small businesses. So looking ahead, what's the next step? What's the next set of businesses that could possibly open? And could that happen before May 26th when Safer at Home is set to expire?
It's possible, but I have to put it in a different context right off the bat. Our initial list of essential businesses in the state of Wisconsin was far more expansive. In fact, I saw the list that Governor Cuomo came up today in New York State that they're opening. Many of those businesses manufacture. Most manufacturers, the vast majority of manufacturers have been open, or they've been. If they're constrained, it's constrained by the market, not necessarily by the state. Construction business has been open. Professional services have been open. Utilities has been open. Transportation, real estate, insurance, finance, all those things have been open. So the remainder is actually a pretty small end if you think about it. It's large retailers and obviously bars and restaurants, arts and entertainment, tourism. So those are the main ones that are still outstanding. And if we get to a point before the 26th that we are able to turn the dial, it will likely be in one of those arenas.
Thank you, Tajma. Now to Jessica Van Egren from Up North News. Jessica?
Hey, yeah, thanks for taking my call. I had a quick question. I was recently at the Home Depot and I noticed that there was a line that was being formed, and it was clear that somebody was sitting there with a clicker allowing people in and out. I'm wondering if that action is something that the stores, that the big retailers that are open imposed on themselves, or if that's something that the state passed along to them, based on their size, like X amount of people can be allowed in your facility at a time.
Sure. This is Ryan Elsastoin. So when Safer at Home was extended, one of the things that was done that Secretary Palm and the governor did was expand the number and types of businesses that were open, just as the governor talked about how Wisconsin, throughout all of this has had more businesses open. Another thing that was done was to make sure that there was adequate social distancing at large retailers that have been deemed essential this entire time. And so one of the ways to do that is having store capacity based, a number of customers available in these very large stores based on their capacity. So depending on the number of square feet they have determines how many people they can have in the building. And so I'm assuming in your situation at Home Depot, that was the method that they were using to make sure that they were in compliance.
And this is Governor Evers. I'm really hoping that instead of standing outside in the line there, that they would consider going to their local businesses on Main Street that are now open.
Thank you, Jessica. Now to Rachel from TMJ4 in Milwaukee. Rachel?
Hello, I'd like to ask about nursing homes. The DHS has said they plan to begin publishing the names of facilities with known COVID-19 cases this week. The Wisconsin Healthcare Association says they're concerned the listing might be presented or interpreted as sort of an indicator of the quality of care offered by the facility. So what is the DHS's response to the Healthcare Association's concerns?
I appreciate the question. So I think it's really important, I think, to understand that the work of the nursing homes, the long-term care facilities in this state has been tremendous. We have not had the kind of outbreaks that have resulted in large numbers of deaths like you have seen in some other states, and that is because we all together have been committed to prevention through good infection control practices, and as we have now ramped up testing capacity and the number of tests we're able to do on a daily basis, our partnership with long-term care is increasingly important as one of our strategies and one of our priorities for our testing capacity is to make sure that we are able to test all residents and staff who work in long-term care. And this all anchors back to what we have said since the very beginning of this pandemic and what we have seen all around the globe, that folks who are older and are more susceptible to severe disease from this virus. And so these are very vulnerable populations that we all are committed to doing everything we can to protect. And so part of our work together with the long-term care stakeholder community is to ramp up testing. It's to ramp up our ability to help them wrap around a positive case and stop the spread so that we're protecting these vulnerable populations. And we will continue to prioritize that work with them moving forward.
Thank you, Rachel. Now to Addie Bink from WFRV TV in Green Bay. Addie?
Hi, thanks for taking my call. Governor Ebert, I have a question regarding the next, turn of the dial. Could we see these outdoor activities, maybe like mini golf or a zoo, reopen with some restrictions like we're seeing these smaller businesses?
Well, possibly we'll continue to look at the data going forward. The advantage of things outdoors are clear, though. I will say that it's good to be out in the fresh air, but we also have to make sure that people keep the appropriate distances, and whether we can truly believe that we're able to do that under those circumstances. So anything is possible as we go forward, and we'll be looking at all sorts of options.
Thank you, Addie. Now to Lucas Johnson from WORT Radio in Madison. Lucas?
Hi, I had a question about the community testing sites in Milwaukee and Madison. I'm wondering how long the state can estimate they can offer this drive-up testing at the current rate.
And by current rate, do you mean number of tests or number of days? What?
Yeah, number of tests.
Yeah. So we think, a part of our strategy, in addition to long-term care, which I just mentioned, and you mentioned community testing and our partnership with healthcare systems, we are looking to maximize the number of tests we're doing every day, right? Our goal is to get to 85,000 tests a week, about 12,000 tests a day. We are well within reach of that goal, but we are not utilizing on a daily basis the number of tests that we have available. And so we are going to continue to push and encourage folks who need tests to get them, because we certainly have more tests available than we have folks who are getting tested on a daily basis. So we would encourage anyone who has symptoms, even the mildest of symptoms, to avail themselves of the community testing sites that are available, to call your healthcare provider and ask for a test. But testing is absolutely available. It is plentifully available, and we would encourage folks who need tests to get tests.
Thank you, Lucas. Now to Denise Lockwood from Racine County Eye. Denise?
Thank you. Thanks for taking the call. In the city of Racine, we're seeing an emerging hotspot in the middle of the city where the level of poverty is quite pervasive. The city was just listed as having one of the highest percentages of increases of COVID-19 cases, or actually percentages in the United States. But we have one testing site on the very edge of town, and we have a number of people that don't have access to transportation. Is the state looking at providing any test sites here?
Yeah, so we are in active conversations with counties and local public health departments around the state, and will absolutely be bringing more community testing sites online, depending on the request and the needs of the local communities. That will determine how many days we're there before they move on to the next location. But I would also remind folks that our healthcare systems and our healthcare providers have testing as well. And while these community testing sites are certainly very easy to pull up in your car and get a test, there is absolutely capacity among our healthcare providers and our healthcare systems. And so folks should also avail themselves of those avenues to get tested as well.
Thank you, Denise. Now to Stephanie Hoff from West Politics. Stephanie?
Hi, and thank you for taking my call. My question is for Governor Tony Evers or Secretary Palm. Would you please be able to clarify your reasoning for why stores with an outside door, such as the ones in outlets and strip malls, can open, but not stores located inside of malls?
Clearly, there's more opportunity for larger groups to gather inside a mall than going through an outside door. So not the theory, the common sense solution is that those retailers that have an outside access and not using the access of the mall that's the preferred mechanism.
Thank you, Stephanie. Now to Sarah Thamer from WISN TV in Milwaukee. Sarah?
Yes, hi. My question is for Secretary Palm. Why didn't the State Health Department release the names of the nursing homes with positive cases to the public right away, and were lives put at risk because of that?
So we certainly are intending to do that here in the very near future. I think we have been actively engaged both with our partners in long-term care as well as our local public health partners to really focus on this priority population. As we've talked about, we've seen from other parts of the world and from other states in the U.S. that were ahead of us in this outbreak, that those populations suffered mightily when there were outbreaks in long-term care facilities. And so our goal all along has been to work to prevent those outbreaks, and then when we do see a single case, either of a staff member or a resident in those facilities, that we are surging whatever assets that facility needs to wrap around that case and help prevent spread moving forward.
Thank you, Sarah. Now to Will Cushman from West Context. Will?
Good afternoon. I'm curious about contact tracing and a growing number of app-based approaches to contact tracing that leverage location data. I'm curious whether the Department of Health Services or the state is considering adding such an app or some related approach to its suite of contact tracing approaches.
It's a great question. I think, right, when you're thinking about an outbreak of this size and the number of interviews that will be required, finding efficiencies are really important ways to help you manage the number of folks you need to hire to help you do this work. And so we absolutely are looking at technologies that would allow us to do this efficiently and have certainly been doing meetings and seeing presentations and demonstrations of technologies that are available to pair with the boots on the ground people that will be doing this work. I think we are very conscious of and want to make sure we are doing the right things as it relates to people's privacy. And so we continue to look at what our options might be with that principle very squarely front and center for us as we think about how to pair technology with actual human contact tracers.
Thank you, Will. Now to Ryan Burke from Spectrum News 1. Ryan?
Good afternoon. This morning during a presentation by the Wisconsin Economic Development Corporation, it was indicated that there could at least be a possibility that summer camps or summer activities for kids could open up around the state with restrictions. Obviously, that's something parents count on for childcare, and summer's coming up quickly. Do we have any idea when those types of decisions would be made, and if those types of activities are able to open up, what they may look like?
Again, we'll be watching the data for the dialing that we're already doing and also take a look at how those opportunities for children can happen in a safe way before we make a decision on that. Obviously, we didn't make that decision today, but we'll be looking at those items in the near future.
Thank you, Ryan. Now to Olivia Richardson from Milwaukee Public Radio. Olivia? Olivia Richardson from WUWM. And a reminder, *6 to unmute your phone. Okay, we'll move on then to Cammie Rapp.
Good afternoon. In Wisconsin, healthcare does have open bed capacity, testing now over 13,000 a day. We have that downward trend of positive cases. Governor, is Wisconsin where you wanted it to be 60 days ago when you issued that emergency order? And does this latest order today effectively put us in phase 1 of the Badger bounce back? Thank you.
Well, it certainly gets us closer to answer your second question. The first question is, if we would have had the opportunity to have the appropriate testing items and protection equipment, I think we would have been further ahead than we are right now. I'm very, very pleased with where we are, though. The number of tests are dramatically increasing, our ability to contact trace, all the things, frankly, that when we met with those governors from those Midwest states, talked about that we all wanted to focus on, and those are the most important things to focus on to get us to this place where we're actually doing some dialing of opportunities in the economic sector. So I'm very pleased where we're at. I think we could have gotten here a little bit quicker if we would have had better access to testing materials and PPE right off the bat.
Thank you, Cammie. Now to Sari Lesk from Milwaukee Business Journal. Sari? Milwaukee Business Journal. Okay, we'll move on then.
Me now?
Yes, we can. Go ahead,
Can you hear me now?
Yep. Yes.
Okay, hi. Thank you for taking my question. With bars and restaurants being among the remaining industries that are not yet allowed to open to the public, I'm wondering, are you anticipating any restrictions for bars and restaurants as we move toward those businesses opening?
Well, I think it'd be clear what other states have done in this area. They've restricted the numbers of people in bars and restaurants. The social distancing. So I would think when we do get to that point, there will be restrictions. Yes.
Thank you. And we go now to WAOW TV in Wausau. WAOW. WAOW TV in Wausau. Okay, then our final question. Hello?
Can you hear me from WAOW?
Yes,
Very
we can.
good. Yep.
Hi. My question is, now what's next for bars and restaurants? I'm assuming they're not included in this 5-person allowed limit inside?
Yeah, bars and restaurants aren't considered retail businesses of goods, of final products. They're a separate category, and we'll look at them separately as we do other areas, and we'll do that in due course. This has always been a promise of a slow, deliberate process. We're not going to rush it. We're going to see how this works out today with today's dial, whether we dial that in the next 20 days, in the next 10 days, the next 30 days. It all depends on the data as it comes forward. As I said before, bars and restaurants are not considered retail of goods.
Thank you. Now to WISC TV in Madison. WISC? WISC TV in Madison. And a reminder, *6 to mute or unmute your phone. So we'll go back to some people we called on who didn't get a chance to ask a question. Olivia Richardson from WUWM in Milwaukee Public Radio. Okay, and WLUK TV in Green Bay, WLUK. Okay, with that wraps up today's media briefing. Please continue to monitor DHS outbreaks investigations and COVID-19 web pages for information, data, and guidance. For topics not related to public health, visit the websites of the Governor, Wisconsin Emergency Management, the Department of Workforce Development, and Wisconsin Economic Development Corporation. Thank you and have a good afternoon.
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.
Hi, I'm John Henkes, President of WisconsinEye Public Affairs Network, and I'm speaking to you today to ask for your financial support. For 14 years, WisconsinEye has provided uninterrupted, gavel-to-gavel live coverage from our state capitol, the legislature, the Supreme Court, the governor's office. We're proud to continue to do that and continue through this time of crisis with important coverage. We are 100% committed to bringing these important meetings into your home or place of work. We've created online pathways that allow us to connect you live with these important events. But WisconsinEye needs your help to do so. At this time, we are facing unprecedented staffing, technical, and financial challenge. So if you rely on our coverage to stay informed on issues you care and need to know about, I ask that you consider a one-time charitable gift today to help us through this challenge. Whether you're following the DHS briefings, the Wisconsin Elections Commission, or leadership briefings from the state capitol, or any of the timely interviews conducted by our senior producer, Steve Walters, we could use your support today. If just a fraction of the thousands who value WisconsinEye coverage say yes with a gift of any size, it will provide a huge boost. So thank you. To donate, please visit wiseye.org/donate. That's WISEYE.org/donate. Or send a check to WisconsinEye, 122 West Washington Avenue, Suite 200, Madison, Wisconsin, 53703. Again, thank you so much. Please be safe. Stay optimistic. We are Wisconsin.